My name is Amanda Neal, and I am the owner of Ultimate Health Direct Primary Care. Ultimate Health is a medical clinic where we do healthcare a little bit differently. We remove the barrier of health insurance and we put the patient back at the center of care. So our billing model is set up on a membership model. Our patients pay once a month and they have 24-hour access to me. I am a nurse practitioner, licensed independently in the state of Florida. The services that patients can expect at Ultimate Health Direct Primary Care are various. It's like Walmart for healthcare. I am offering the primary care side, so you have 24-hour access to me. You can call day, night, weekends via telehealth, text, email. So you've got 24-hour access to your primary care provider, not the staff, not an answering service, but also we have a 8-chair IV hydration suite. So if most of us don't drink properly, so we've got IV hydration available, we've got detoxes via IV hydration, we have the hangover cure, we've got performance, and also we do some intimate wellness services for erectile dysfunction and vaginal rejuvenation. So it's kind of a one-stop shop for healthcare. I originally sought out services from the SBDC because I went into my local credit union and the branch manager's like, Amanda, you have a great idea, but you need a little bit of help. We need to, because I am a healthcare provider. I am not a businesswoman, or I wasn't a businesswoman. So he knew I needed a little hand holding. So he referred me to Eddie, who put me in touch with Jamie, who I affectionately call best friend, who helped guide me along that path. But it was my local bank that directed me to SBDC. The services that I received from the SBDC were numerous, too many for me to remember, but I know that I just had an idea. And with my consultant, she took my idea and helped me do our business plan. We must have written it about 15 times, but it went from just maybe 8 pages to, it was 18, but it was 18 pages of good information. So we were able to assess my competitors. She helped me track down what my competitors were charging, what they were offering, how well they were doing. We were able to figure out who my target audience was. And then even after all was said and done, we worked on my marketing plan to make sure that we were successful. Together, she and I, we went after an SBA loan, which was one of the most difficult things to do during the pandemic, but we were successful because she helped with everything that the bank needed. We came back, I'd say, this is the checklist they've given me. And so my consultant was able to help me get all those numbers as far as profit and loss statements, which was a foreign language to me because I do healthcare, and also expenses and budgets and all those things, making sure that I was ready to open on August 16th. My experience in working with the SBDC, I went from just a concept, just an idea of doing healthcare, removing the barriers that I've been experiencing in traditional healthcare, to getting the bankers that were going to approve my SBA loan to understand that concept. They were a little bit nervous based on the demographics of the small town of Leesburg within Lake County, that those in this area would not see the value or be able to afford a cash model. And so we had a charge of being profitable in 6 months. And in order to obtain that goal, we had a goal of having 100 members enrolled by January 1st of 2022. We opened our doors on August 16th, 2021. And as of today, we have, which is just 30 days later, we have 48 members enrolled and they're paying. So we are just about halfway there, and we've only been open for 30 days. So I think they like us. What I would say to a small business owner, an entrepreneur, someone with a dream in their heart who's considering working with the SBDC, what are you waiting for? What are you waiting for? It only benefits you and your future consumers. What are you waiting for?